Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OBGYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community, to another episode of Sky Women. I'm so thrilled that you are here with us today. We have a special guest with us, Dr. Janiqua Benoit. She is also known as Dr. J on social media. She's a board-certified internal medicine physician and sports medicine specialist. She is a runner, exercise enthusiast, and former ACE-certified personal trainer. Not only does she enjoy caring for athletes, she also has a passion for teaching her patients how to use exercise as medicine to decrease their pill burden. This is so exciting. Welcome, Dr. J.
Hi, I'm so happy to be here, Dr. Carolyn. I admire you from afar. Doctor with 4 boys, and you look so great. So I'm so happy to be here.
Thank you so much. You're so kind. Welcome. Well, this is exciting. I love preventative medicine. And I love this idea that through moving our bodies, through exercising, that we can help to decrease our pill burden, that we can stay healthy and prevent disease. So talk us through your passion and what led you to this.
Oh, yes. So I remember during my second year of residency, after a long, stressful clinic day, I just couldn't wait to go home. And as I rushed home and I sat on my bed, which was like my place of solace, I was thinking that I was much like my patients. And it was because, like my patients who felt that they were overwhelmed from taking so many pills, I was overwhelmed of having to refill them or prescribe them. Much like my patients who felt like they didn't even know why they were taking some of their pills, I felt like I lost my purpose. I didn't know my why and what was my purpose as a physician from this point. And also, like my patients, they felt like they didn't feel in control of their health. I feel like I didn't have any control of the trajectory of my career. And it was like looking down a dark tunnel with no end. And really, it was exercise that was the means to the end. Because what exercise taught me, it taught me the power of creating a habit. And with exercise, you can't reap the benefit by just doing it one time. You have to make it a habit. So that's why I'm really passionate. And I try to teach my patients practical ways of how they can incorporate exercise by making a habit. So it doesn't feel like a chore.
Okay. All right. So talk us through that.
Yeah. So I actually have a method for helping my patients use exercise as medicine. And it's an acronym and it's HABIT. And H stands for healthy mindset. A stands for affirming new beliefs. B stands for believing greater. I stands for incorporate change. And T is transforming lives, because I love that you're an osteopathic physician, and I am too. And as an osteopathic physician, I want to be able to transform my patients' lives from the inside out.
I love it. So let's hear about this. So about the habits.
Yeah. So I can talk about healthy mindset. And I actually have a patient to demonstrate how I use this with him actually. So this patient came in, and like I usually do when I see my patients, I ask them if they exercise. So I asked this gentleman, do you exercise? He said, no. I said, why don't you exercise? He said, well, I'm not motivated enough. I was like, why aren't you motivated enough? And at this point, he gave me those side eye, excuse me, ma'am, you're all in my business. Can you just stop? I'm just here to see you and be about my business. Yeah. No, we're going to get into this. So he said that I'm lazy. And in my mind, I'm like, okay, well, that's a limiting belief.
Right.
So I decided to get into that a little bit further. He said, I asked him, do you have children? He said, yeah, I have 3 young boys. I'm like, okay. I'm like, well, would you exercise for your 3 young boys if you knew that it would give you a healthier lifestyle so you could be around longer with them? And he said, of course. I said, so you're not lazy. You didn't have a strong enough why. And that's the whole point. I try to get my patients to have a strong why, because according to the American College of Sports Medicine, you're supposed to exercise at least 150 minutes if it's moderate intensity and 75 minutes if it's vigorous intensity. But when I say that to my patients, they're like, you think I'm just going to start all of a sudden, exercising?
Right. And let's clarify, that's 150 minutes a week. So that can be broken up, correct?
That can be broken up.
Right.
Yes. Yes. If it's moderate intensity, and 75 if it's vigorous. So I try to have a compelling, or get my patients to get to a compelling why of, what would make them exercise. So that's how I incorporated the healthy mindset. Is I wanted him to get out of that lazy, limiting belief. He very well demonstrated that he's not lazy, that he would do this for his 3 young children. So that's an example of that.
I love that. I think also that, we just have to make the commitment to ourselves, right? But you do have to have that why and that desire, but we can't rely just on how we feel. Because if we just rely on how we feel, then we're not going to do it half the time, right?
That's exactly right.
We have to make that commitment to ourselves that this is what I'm going to do. This is going to benefit my body.
Definitely.
Let's hear the next one.
Okay. All right. So the next one is actually the same patient. So this is how I incorporated my A, which is affirming new beliefs. Because once you have a compelling why, you can forget it. We're human. So I told him, I'm like, okay, well, you said that you would do it for your 3 young boys. So I want you to make that into an affirmation and, make it visible. I told him you could put it on your cell phone. You can put it on your fridge where you can see it. You could place it on your mirror. And when we have these new beliefs, these stronger beliefs that serve us, it needs to constantly be in our subconscious so we don't forget, because it's very easy to forget, especially if it's new, right? It's not a habit yet. So you kind of have to train your brain. Like, okay, this is why I'm doing it. This is why. It's everywhere I look. Okay, I get the point. Yeah, so I left him away with that tip, and he was I remember him seeing like wide-eyed, like, whoa, I never thought about that before. So that was another practical way that I incorporated my method.
Okay, awesome.
Yeah. And then I have another one. So this is incorporate change.
Okay.
And this was a middle-aged woman, and I asked her if she exercised, and she says, no, I don't have time. And I said, well, why don't you have time? And she says, well, I have 2 young children who need me, and I'm, caring for my elderly mother who's sick right now. It's a lot on my plate.
I get that. I hear that all the time. All the time.
Especially from women, right?
Yes, because we're so busy being the caretaker for everyone else. And I'll tell you, whenever I was a mom of 1, I would give women this advice all the time: put that baby in the stroller, just get going, because I ran. Then I had 2 and 3 and 4 children. And I'm like, oh, now I know what they're talking about. It is hard. It is hard to prioritize it. But now I just find that I have adjusted it and changed it over time. So whether it's I'm putting a YouTube video on and doing a HIIT exercise at home in the playroom while they're busy around me, but they feel like we're spending time together, Sometimes I don't have the time to get out to the gym or go for a run or whatever, but I can still be physically active. We have to be willing to adapt, right?
For sure. For sure. So I told her, I'm like, okay, I understand that you have a lot on your plate. Completely understandable. But I want you to, look at your schedule and look at your priorities for the day and see where you can incorporate some, level of physical activity. You can start just by walking. And, I said, well, maybe you have time before work. Maybe it's after work. You have to evaluate, are you a morning person? Are you a night person? So you have to look at things like that. So you can find opportune times that work for you so that you can make time for yourself. And really what I was, helping her see was that you're busy, you're doing a lot. Everyone needs you, but you can't give from an empty cup. You have to look at your schedule and prioritize yourself. It's definitely possible that you can, but you have to make time for that. You have to schedule it, because if you don't schedule it, it's not going to happen. And obviously things do come up, but you want to prioritize that and prioritize yourself. And this is really for all the women out here because
absolutely. Make a date with yourself and just put it on the books like it's happening. Oh, I've got to go. It's 5:00. I have an exercise class or whatever it is.
Yes.
Keep that commitment to yourself like you would with your girlfriend for lunch, right?
Exactly. Yeah. So those are some of the ways that I incorporated my method. So I really love just helping people find practical ways of how they can, start to exercise, because just telling them to do this sometimes it's simply not enough.
Now, do you recommend a specific kind of exercise, or I always say do something that brings you joy?
Yeah. So it depends on the person, right? Because if they, haven't exercised before and, they don't have many technical skills, then I would say walking. Or if they like to dance, I'm like, hey, put on some music and start dancing.
Yeah.
That's like one of the best ways to exercise, get the kids with you.
Yeah. My kids love to have dance parties.
Right. Yep. Yeah. So something like that, something easy, fun, where it doesn't feel like a chore, right? Because if it's like, oh my goodness, I have to exercise, you're not going to want to do it. So something easy, simple, where you can actually get more people involved, like making it with the kids. If, try if you're a busy mom or a busy professional, that's a great way to have an exercise routine and incorporate your family in it too.
Yeah. Yeah. When I go for runs, I tend to just have the kids ride bikes with me now that they're getting where the little one never makes it. He always winds up back in the stroller, but we barely get 100 yards, and he's done for. But the other guys will ride the bike along with me. Or if I ride my bike, I say, who wants to ride the hill today? How many times do you think you could make it? And so they'll try, and then, they tap out whenever they're done. And then mom gets to finish her workout alone. So,
oh, that's so good. Well, and I love that. I love getting the kids involved. And although I don't have children, I have my goddaughter. So when we do hang out, it's so funny because, so she calls me Nenin, right? It stands for godmother in Haitian Creole. She goes, Nenin, it's time to exercise.
Love it.
So she actually comes to me now to exercise. Yeah. And really what you're doing, you're setting such a great example for your children, it starts at home. It starts at home. So that's amazing.
So tell me, your patient in internal medicine, God bless you for being an internist. That was not my cup of tea. But tell me, are you incorporating this into your general practice? And are you seeing your patients reducing their medication load?
Yeah, so I do incorporate this into my medical practice because exercise is what I love to talk about. So I'm always asking patients, do you exercise? Right now, I can't see that I see it for sure because I'm just out of training. And when you're in training, you sometimes don't see the same patients over and over again. Yeah. But exercise is, preventative. And this does not also minimize a healthy diet as well. So what my goal is, and really my mission moving forward, is to incorporate this practice with my patients so I can see and evaluate the results that they're getting, because I know that it definitely is possible. Exercise really should be a vital sign.
Agree.
Agree. We get blood pressure and heart rate and we get all those things, but I really try to make exercise a vital sign. And, if a patient is not exercised, I try to evaluate why. And if I have the opportunity to see them again, reevaluate that and ask them, okay, what happened? Like what went right? What went wrong? How can we move forward in the right direction from here?
Well, and I think so often that we overcomplicate it as humans, right? Mm-hmm. We think that we need some fancy equipment or a new bike or a gym membership or all this, when really you just need some sneakers and to go for a walk, truly. And then work your way up from there, right? Maybe you find something else that you're interested in. Maybe you go for a swim. Maybe you decide you're going to join a cycling team or something of that nature, if you need group or community.
Yes. Yeah, no, I love that. And that's another thing that I would tell my patients, because I told them it doesn't have to be complicated. Just think about it. If you have a lunch break, you can go out for a walk, okay? Instead of taking the elevator, if your knees can bear.
Yes,
take the stairs. Take the stairs. If you have to park for work or whatever, park farther away. so you can walk to your destination. Just little things here and there that can help you incorporate physical activity. You don't have to go for a marathon. You don't have to be an Olympian. Just little things here and there. And consistency is key so that you can make it a habit. And then once you start, doing it consistently, it can become a habit where it's like, okay, well, I'm going to park my car farther away so I can walk. I'm going to take the stairs instead of take the elevator.
Have you found that with the new Fitbits and Apple Watches and all of the monitoring that people are trying to be more active? Are you seeing that in your practice?
Well, it's interesting because the practices that I worked in, it was a very underserved population. So a lot of the patients that I saw, didn't have access to that. So I literally would show them, I would show them exercises in the office. Yeah. Or I would, I would provide them with information where they can exercise according to their lifestyle, right? Because a lot of them could not afford gym memberships. A lot of them, couldn't do things like that. So, that's why I would incorporate things like walking or, dancing with your children, things like that.
Mm-hmm. And YouTube, it seems like everybody can get access to YouTube.
Oh my God, yes.
And you can do so many workouts from YouTube. So I mean, there's so many ways to do it for free, right?
Yeah, so, definitely.
Awesome. Well, tell us how we can find you. How can we work with you?
Yes. So I'm on Instagram at MEDFITDO. That's MedFitDO. And I have a link in my bio, which also has my YouTube channel. So it's a link tree. You just have to hit my link tree, and my YouTube channel will also be there. So I'm on those two platforms, Instagram and YouTube.
Fantastic. This is awesome. So everyone, I want you to go check out Dr. J. Look her up at MedFitDO on Instagram and follow to her YouTube channel so you can also learn some great tips for getting moving in your life and keeping yourself healthy and off medications.
Yes.
All right. Thanks for joining us.
Thank you, Dr. Carolyn. This is so much fun.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a Neuromusculoskeletal Medicine Fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.